Thank you so much, Jacqueline. And we're really excited to be here and to share what we've been working on across the country, but more specifically in Alaska now through your relationship and through Health Time. So thanks for having us. This presentation will be supported by our new colleague, Caleb. And so we'll just do a quick introductions first. We'll go into a little bit more about Pear Suite, our history, our background, our work in this space, specifically around the social determinants of health and how we are empowering community health workers. And then we'll do a little reflection and open it up for questions. And certainly, I would love all of your engagement in this discussion as we think more about how we can empower community health workers and use tech in empowering ways to enhance how we address the social determinants of health. So a little bit more about myself. I'm actually a former senior living administrator. I previously worked in senior care. I took care of 150 older adults, and it's something that I actually grew into after volunteering as a high school student at a nearby nursing home. And so in high school, I would, every day go up and down the elevators, taking residents up and down to do the activities, to do bingo. I led cooking demonstrations and really got to know older adults. And so that's always been my passion. But I also love the combination of technology and how the next generation of leaders can actually take some of the reins of how we can transition to more scalable, effective, and tech-enabled solutions. I then worked for Shared Care, focused on the Blue Zones project. These are places across the country and across the world that are recognized for their longevity practices. People doing things around food and transportation and housing and planning and worksite well-being, and trying to bring those best practices to cities across the country. And also led some community health worker program courses during the pandemic. And so helping to train and incite and empower the next generation of community health workers. We helped to train 250 community health workers in Hawaii during the pandemic, and I was part of that team. I would love to also introduce Caleb before we get into our presentation about Pear Suite. Caleb?
Hi, everyone. Jemai, my name is Caleb. Swooped back from Anchorage, Alaska. Very excited to be here. Family's from Old Harbor, and now working at Pear Suite, but I'll tell you a little bit more later as well.
Awesome. So at Pear Suite, we're on a mission to empower and enable community health workers. We do that through our care navigation platform, which I'll show you in a bit. I know in Alaska, the state sometimes recognizes community health workers as community health aides and practitioners, but for this presentation, I'll just use community health workers. Our team has grown. We launched in 2021. We're now about 15 full-time employees and a bunch of part-time employees. We also have amazing advisors, and everyone brings diverse experiences and backgrounds to the table, and we love that. We have people that came from more technology and software systems, people that came from population health and community health, some that came working with providers and clinicians. David, who's in the middle there, he's one of our lead community health workers, and he's a program coordinator. He has lots of family in Alaska, so he just came back, and I asked him why he didn't bring me any fish, but he said that he ate it all, and that's one of the most requested things when he returns back from Alaska. Right now, we are doing a bunch of different things, but I'll share more about our history first. Pear Suite actually started during the pandemic, during COVID response, helping individuals get connected to COVID resources, everything from vaccination and test kits to learning about best practices around staying safe. We were really utilized to reach out to older adults during the pandemic, but also the AAPI community. We're really passionate about that community. Of course, in Hawaii, large population of AAPIs, and we started doing work with them through people that spoke different languages, people that were from the communities which we're serving, and that was really exciting for us. We later learned about the different needs that these community members had. So it wasn't just COVID response. It was, we have a lack of food, we have housing challenges, we aren't able to pay our bills, and so we started doing these population assessments, and kind of as we go left to right. Then you're into, hey, we want to stay connected to our friends and family. We want to jump on FaceTime too. We want to learn about free internet and get broadband access. So we started helping people with technology. And then we actually met some organizations that wanted to do follow-up and help individuals get connected to resources. Everything from, they got a vision screening, but need to get glasses. How do I then visit the optometrist to get glasses? Or maybe someone tested positive for having a hearing deficiency and wanted to get hearing aids. Like, what is that process like, and how do we support them with community health workers? We since evolved from then, and I would love to share more about that as we go into Pear Suite. But what the underlying issues that we're trying to address is around these social determinants of health, right? Food access, technology, social connections, transportation mobility. Of course, a lot of these are really needed in rural and remote areas, and certainly a concern for people in Alaska, and of course across the country. Millions of struggling families and all these social challenges might be facing. Thankfully, there's lots of social resources out there, things like public housing and food resources, SNAP benefits, Meals on Wheels, the YMCA. All of these are great resources. And we have these empowered community health workers and care navigators that are out there. But oftentimes, these groups interact in a confusion manner with slow, delayed reactions to things. They're more reactive, oftentimes on paper and spreadsheets. And we really see an opportunity to bring them together, to unite them with technology. And that's really where Pear Suite comes in. So Pear Suite is a social care navigation platform for community health workers, essentially like a CRM for social care. We can collect data, visualize it, particularly around the social determinants of health, understand how this is impacting the individual in a culturally sensitive way, and act on it. And we all want to do this with technology and really empowering the community health workers with their background, experience, and trust, not take over what the community health worker does. And so we really see ourselves as empowering these navigators. Just to share more about our platform, I want to give an example of Anne. And a scenario of Anne, maybe she's an older adult. She might live in Kodiak. She doesn't drive. She has housing insecurity. She might have other challenges as well. She might not have family. And I want to give you an example of how our platform can empower a community health worker that's helping her navigate through her challenges. And so our software itself it's like I said, like a social care navigation platform. It's like a CRM for social care. We have social profiles in this dashboard, and we can actually see the different members we're working with. We might give Anne a ring by phone or see her in person, ask her about her needs, understand her challenges, her interests, her values, and build out a social profile to see what are her challenges. And yeah, she says she has housing challenges. And so how do we help to navigate her to social resources, get her connected to these options like Section 8? We can create goals and track them in a tech-enabled way that provides next steps and social solutions that are embedded into our platform. It could be a follow-up in 2 weeks. It could be helping her fill out forms. It could be providing her local resources that meet her language needs. Food is also a big challenge, right? So having food resources and being able to do external referrals. And so maybe referring her to a local resource, in this case, the Meals on Wheels program, or maybe it's a food bank. If she's interested, and obviously we want to empower community health workers to do motivational interviewing, we can then track all those activities and see how we can help her toward her goals while doing it in a person-centered, culture-sensitive way. And so our platform is really, taking over what maybe previously was done on spreadsheets or on paper checklists. We can track activities and track time, which is really good for documentation and use for grants and activities that might align with more funding. This is our external resources page where we can actually see what organizations are we connecting them to, what are the capabilities and hours and contact information. We have population level data and individual level data as well. We want to see who's being impacted, how, also where are the gaps. This allows us to make metrics and changes to the program, and also how are the effectiveness of the community health workers impacted, and how do we improve that? So our platform is really dynamic. It's customizable for every organization. This is what the individual member profiles might look like. And our whole goal is how do we close the loop on Anne's needs? How do we help get them connected to resources and track it over time and see what the impact of these resources are? This is our ability to customize these workflows. So we actually will come and work with each customer or each partner to build out the workflows. What are the steps they want to take to get them to their goal? How do we change this based on where they live, their ethnicity, maybe their age group? We can build the custom dashboards to really align them with their needs. And everything is done by paper, by phone and text, and we're looking at video as well. So our platform overall will help organizations, whether it's community-based or clinical, increase member engagement, drive health outcomes, boost independence, and help with staff efficiency. That's really important to us. Pear Suite actually offers two different services right now. We have our software as a service. So they can actually just use our software. They might have their own staff that they want to empower and enable to do this work on their own. And we want to help build them custom workflows and help them improve their efficiency with follow-ups or collect different data points and see the impact, and also really manage their resources in a cost-effective way. Or we can also hire local community health workers and actually empower them to work with a partner organization, maybe a health plan that needs us to help address the social engagement amongst their members, or help them enroll in these community benefit programs, or help them get connected to a provider in the local area. And so we have two different offerings that we will do. And obviously we do a hybrid of this as well. Our platform is extremely flexible and very secure. We use some standardized assessment tools, and we have some licenses with others that allows us to have a good understanding of what their needs and challenges are, while also tracking against some baseline metrics. We're fully integratable, so we can integrate with other EHR or CRM tools that a health system or health plan might be using. And we're very secure. We have both HIPAA and SOC 2 compliance for our platform, and we've been able to work with wide variety of organizations to support their integration and data needs. So really proud of that. Who we work with a wide variety of organizations. It can be anything from health plans and housing agencies and clinicians, small providers, large providers, other startups and companies that want to collect good data, health departments, organizations that maybe need some assistance gathering population level data or addressing social needs. And then also nonprofits, small organizations that maybe may not have a big budget, but want to collect this data in a meaningful way. And we've been successful at working with lots of different organizations to date. And so some of the organizations across the country, everything from the YMCAs and public agencies to health plans and nonprofits, working with about 27 right now across the country, everywhere from Oregon, Alaska, and Oklahoma to Hawaii, California, and Alabama. So really excited about that, and impacted about 25,000 lives to date. We've also been proud of training community health workers. We can help them with their career growth, helping them learn about documentation and coding, things that they might not get in a traditional community health worker training program. Through our platform, they can work more efficiently and understand how their work impacts the cost savings and health outcomes of these individuals. We've been really proud to maintain a strong engagement score with our members, to being able to actually help people take actions toward their goals. And then, of course, having to do with efficiency, we're able to increase that by about 3x. So people are more effective now. They don't have to have sticky notes in their tab paper or create calendar invites for themselves to call an individual. The staff that use our software internally, as well as external community health workers, love the platform. We design and build this platform for them, and so their feedback is critical, and it's shown in our customer retention and user satisfaction scores. Really, their being part of it is making our platform really accessible and equitable for all. We're really proud of some of our national partnerships that have been helping us get there, working with older adults, underserved communities, the Medicaid population. These are some things we really care about, and we're excited to grow in these different areas, particularly those who need it the most, the marginalized communities and beyond. We've launched some early work in Alaska, which we're really proud of. And so being able to support Alaska Literacy Program and the Anchorage Peer Leader Navigators. We actually just met them in June, but through Health Ties, so really thankful for that relationship. But we already launched implementation with them in August. With them, we are helping them translate their workflows into our platform, helping to assess social needs, document their outreach, and track outcomes. In the future, we're hoping to grow with beyond just a few community health workers or peer-led navigators we're starting with, and also trying to do some expansion with the external resources we offer, the goals, and the automation. Really excited about that. So just to wrap it up, we'd love to connect with all of you. We love meeting organizations that hire community health workers or similar roles. We love connecting with training programs. They sometimes use our platform to help empower students during the training process. We love health plans and clinics, of course. They have a stringent need for more solutions for social determinants of health, and of course, tribal organizations. At Pear Suite, we really believe that relationships matter, and that's why we love what we do. We love building relationships, not just with organizations, but with the people we serve. And we also think that's the solution to every other social determinant of health. And so with our platform, we really enjoy working with health community-based organizations, and hope we can help you and your organizations and your partners as well. And so thank you so much, very much. We look forward to connecting, and love to pass it over to Caleb for some final words.
Thanks, Colby. Caleb. I'm Caleb. My family's from Old Harbor. I'm from Anchorage, Alaska, and we're Sukbiak or Lutik, depending on who you're talking to. So my background, I worked at South Central Foundation. There, I led our COVID-19 vaccine rollout. Then I went on to cook in the tribal council. I got stolen by Gloria O'Neill. And there I worked on our COVID-19 response with Leanne Garrick and was kind of a public health program manager there. And then I went to Google and focused on medical device compliance. And now I'm here at Pear Suite, which I'm very excited about. When I think about Alaska and I reflect on innovation, I think about a lot of the key questions that were presented in the places I worked. South Central Foundation, for example, is a formal healthcare setting. And inside of that formal healthcare setting, we had a lot of questions about the people we served, our customers. We know what's in their EHR. We know what their diagnosis is. What do we know about where they live, about their day-to-day lives, food insecurity, housing insecurity, et cetera. And it wasn't that this information didn't exist somewhere. It's that it was documented nowhere. We had inside of the EHR all of the information needed to continue creating a care plan, but none of the information to be able to really determine at a population level what is a barrier to moving forward and at an individual level. At Cook Inland Tribal Council, I saw a lot of that individual one-on-one care happening with CHWs, CHAPs. We didn't use those words, but I think a lot of us are familiar with navigators, people that are in the center of the spider web that bring people to one area and then navigate them to where they need to go. Often those people aren't provided the tools they need to be successful. We have EHRs for physicians and nurses, CNAs, CMAs, but for people who are in deep relationship with the people they're serving, there's often a gap in the tools available to empower them to gather information, prove their efficacy, prove their worth, and then surface population level data to leaders. At Google, we thought a lot about how information can empower people, not replace them. So, I think my time here at Pear Suite has been really exciting because I have this background of understanding that Alaska is a really innovative place because we have to come up with innovative solutions due to the way our state is set up. Having a low population, which may not be the most exciting to provide funding to, but also having really difficult geographic settings where we need to deliver care to a lot of different areas with different types of people and different settings of resources that exist in those areas. So I see Pear Suite as an opportunity for Alaskans to try something new, to step into that innovative boot that we've always had, and to really focus on using technology to empower relationship instead of overpower relationship, which I think a lot of other data and tool systems and platforms are built to do. So I'm very excited to be working here. And this year I'm starting med school next year at WSU. Hope to come back and deliver care back in Alaska, maybe Sylvia or Kodiak. But in this year, I think that working here is very important to me. And one thing I'm really excited about, thank you to Jacqueline, is that there aren't very many avenues for Alaskans to see what is happening in the tech space. And this is an opportunity to do that. So I'm really grateful that we get to be here and provide this as an opportunity for conversation or potential collaboration. And I'm really thankful to everyone who made it to the presentation today.
Well, Colby and Caleb, thank you so very much. Those are wonderful presentations. And Caleb, I can't explain enough how your insight and your ability to help understand where Pear Suite might be helpful is so invaluable. There's other people on this team. I would love to open this up for questions. There's some amazing people. I see Lori Pickett, who I'd love to hear from. And she is with the Alaska Literacy Program. And so she has a really neat perspective that I'd love to hear. We also have Carlin Evenhoff, who is a nurse practitioner and is a wonderful resource. She's actually with Healthy Connect Alaska, and so she has a wonderful perspective as well. So open it up. Are there any questions that anybody would like to ask?
Well, I'm curious about our team here is really excited about Pear Suite, and I'm hearing nothing but good things from the way that it's being integrated into our programs. And what I feel like I'm hearing, as because I'm the executive director, I'm not doing as much of the really in the weeds work, but I still am really connected because we are a community-based organization. But then I step into the other space, the executive director space, and I'm hearing things that are happening within our state where the information is clearly not reflecting what's happening for the people on the ground, especially around things like the Medicaid renewal, the SNAP renewal that our state's really suffering from. In the meetings right now, the message out is like, we really got this under control, but what we're hearing, and I would love to know how we can really use this to help the people solve their problems, but what can we do to really use some of this information to push the decision makers that are not really getting the information they need and understand that that it isn't what they're saying it is. And there was a lot of words, but thank you.
Yeah, I love that. Yeah, one thing we actually are doing is working with some of our funders that really are think and do tanks. And they really care about the data around what are the gaps in the healthcare system right now? What are the needs? What are people saying on the ground? You know, if people aren't signing up for these public benefit programs, why not? You know, asking those questions and being able to embed them into our platform is facilitating this data collection. And I think that's just as important as who are benefiting from it, right? People that aren't, like, who aren't we reaching? If we know that the state and those who are impacted by certain challenges make up a certain amount, like if we're not reaching them, you know, who are those and why not? And how do we make sure that equity and access are prioritized? And so, yeah, we know that we can't just add, you know, or hand out flyers for programs like SNAP benefits. The application process is just too complicated. And then, you know, walking them through, you know, explaining what the program is, how it works, the fact that it's free and accessible. There's an application, you have to maybe sometimes appeal your decision and then renew it every so often. I mean, that takes a navigator to do. And I think every step of the way, we can track data on what people are experiencing, what those challenges are. And then if people aren't, you know, being accepted, why not? And if people aren't using it, why not? And that data can be presented to the people that can make decisions around adding more resources or increasing the accessibility of these programs. So yeah, I love that.
Yeah, and I think, Lori, for you or for anyone that would be interested in working, I think that is what's so exciting, is the flexibility of how we can build things out specific to the organization that we're working with. So as questions surface, like, I want to integrate a question about this, and I want these to be the following outcomes of the reason why. And when we have that tracked, that's what can be surfaced. And I think too, there has to be a conversation, like, a lot of these workers who aren't traditionally having tools built for them aren't used to documenting and the reason why we document. And so I think, like, on our side, there is a responsibility to be able to build out the workflows that exist. And I think in a collaborative side, there is an importance in, like, change management and making sure that we're describing and outlining why is it so important to document? Why is it so important to use this tool? Especially when people haven't been used to needing to document their work before. It can feel like it is almost like a big brother expectation, when really it's saying, we're taking your work and surfacing it. And this is the reason why. Lori, I'm asking you to document this because I need to be able to bring this to legislators and talk to them about what's not working. And so in the future, hopefully this will improve your work. So I think there's a little shared responsibility as well when we can build a workflow and then also support and change management.
That's wonderful. I wondered if, Kathleen, you work in the behavioral health space and things like that. I'm wondering what your thoughts are right now as how you might use something like.
Yeah, so I actually just recently left my position at our local tribal clinic in their medication assisted treatment program to start up my LLC, which connects people to different recovery technologies. So I wanted to come in and hear about your presentation and your business. And one of the key challenges is connecting all the different providers, all the different pieces. So what I do is I talk to people and connect them to overdose detection and alert systems, opioid withdrawal management devices, online behavioral health platforms, ways to monitor alcohol consumption remotely, and medication compliance. So what services are we providing? What do they need at each step along that treatment and recovery process? And how are all the different players being brought in together? Because we know that people are getting a lot of different services from a lot of different people. They might be tied into different state programs. And so to really look at who is getting which services and supports, and looking at the broader picture, which combination seems to yield the greatest success. And then being able to look at that on an individual level, perhaps a family level, a population level, and really, like Lori was saying, make those informed decisions, because sometimes we get the really good feedback because we like to share good news. We want to make it look like we're doing a really good job, but sometimes the challenges just exceed what we're able to do at the moment because we don't have all the right tools and information to really know what we need to do next. So with what y'all do, it sounds like you can connect all these different people together to really see what's happening and really fully support that person. So it's not just with elder care, but with any group that needs that data and that structure. So you're kind of open to support anybody who needs it, correct?
Absolutely. A lot of our work is with the Medicaid population. A lot of them were specific We do some work with just older adults with dementia. We do some work with the LGBTQ community. We do some work with public housing sites where the residents are the members that we support. So yeah, I think it's interestingly, when you can customize the workflows and the assessment tools to a specific population, it's oftentimes more effective that way.
Mm-hmm. So, well, I loved your presentation, and I'm very intrigued by Pear Suite. So I'm glad that y'all did this today.
Thanks.
Thank you so much. And I'd like to maybe call out Carlin, because we were just in a conversation, I think on Tuesday, about social drivers of health. So Carlin?
Yeah, no, I actually just had a question. I was just curious, what's the data governance model around how you can aggregate, share the data collected?
Yeah, it really depends on which organization we're working with. We are doing some work, early work with some HIEs, and that obviously has some interests around making data accessible to other providers and groups. But we really give the data back to the primary customer. And so we have some different rules around consent and around getting authorization to use it. And then we can use BAAs or business associate agreements to share with different providers or whatnot. In some cases, we're a covered entity. Other times, it's a community organization that doesn't want to collect HIPAA or a PHI. And so depending on what kind of organization they are and what their standards are and their policies, we can abide by those. Yeah.
No, I love that. There's a lot of great work going on. Some of it is widely known and some of it's in silos that some of it overlaps. Some of it is in some ways duplicative, but in other ways would really play well together and could kind of elevate each other's platforms, products, and impact on Alaskans. So I think this is really cool, and I'm really glad that you guys came and shared today. Caleb, it cracked me up that you said CHAP. I used to be a community health aide out in Naknek. I haven't heard that in a million years. And so I really appreciate everybody being here. And if you guys have any questions or want to chat about health information exchange or kind of what our SDOH data set is and how that could play together, we are all open to conversations around how everyone can work together to make Alaska better.
Awesome. Thank you.
Yeah, awesome. Thank you, Carlin. I, of course, can make that introduction after this meeting. Happy to do that. So thank you. All right. Well, we're very close to the end. I've put my information in. We have our next presentation on the 26th. I want to say a big thank you to Colby and Caleb. I will say we can hang on if people still have questions, but I understand you're also busy. So thank you for 30 minutes of your day, and just really appreciate you all being here.
Yeah.
All right. Thank you, everyone. Thanks so much.
Thanks, everyone. Thank you.
Thank you. Kathleen, do you want to stay on and ask some questions?
Sure. Yeah. If they do, I saw a message in the chat from Caleb, and I wasn't sure if that was directed to me or to somebody else, but I just want to have an opportunity to answer in case. So yeah, with my company, I connect everybody to everybody who needs a solution. So talking on the ground to people who are consumers looking for support for themselves or for a family member, working with nonprofits. I had a meeting this morning with one of Senator Tim Scott's staffers to talk about the importance of integrating technology into the OUD and SUD framework. So just finding where the issues are as it relates to mental health and substance misuse, finding the technologies, and then connecting the two. So I just wanted to kind of be the person that bridges the gap. And when I've talked to the staffer this morning, and even with some people at SAMHSA I've talked to who've been in this line of work for a very long time, when I mentioned things like the bridge device for overdose or for opioid withdrawal management or for overdose detection alert systems, they haven't heard of them before. The overdose detection alert systems are much newer. Those just came out earlier this year, but the bridge has been out for a while. So even people who do this work and are very good at what they do and have done it for a long time, they're not necessarily up to speed with what's available right now because it can change so rapidly with the way technology is going. And then even when we have all those really great individual pieces that serve us very well, if we're not integrating it somehow, if the right hand doesn't know what the left is doing, or we provide this great support or service or technology, then what comes after that? And how do we plan for that? And how do we support that transition? So just in working in this field for a while, those were really the gaps that I was seeing, is that we can improve on those transitional stages. We can identify the individual needs that people have and connect them with things that are available that maybe they're just not aware of. So when I saw this on LinkedIn, I was like, okay, I've got a meeting that gets out like a little bit before this. I'll try and hop on immediately after. So I apologize for coming in late, but it was a wonderful presentation. It was a lot of really great information. I'm going to be visiting your site again here just as soon as I can.
Thank you so
Yeah,
much.
happy to connect later on too as well, Kathleen. Thanks for being here.
That's great.
Thank you so much. All right, everyone. Well, you'll get a follow-up from me as well, and I'll get the recording out. And remember, Kathleen, I'll get a recording on YouTube if you want to share it or something. So I'll send it to you on that day. So, all right.
Thank you.
Thank you, everyone. Enjoy the rest of your day. Okay.
See you,
Thank you.
Jacqueline.
You too.
Bye, everyone.
Take care.
Bye.